Hair is everything, goes the famous dialogue from the popular OTT series Fleabag. We even have phrases like bad hair day and crowning glory in place to remind us of its significance every now and then. Those suffering from hair fall, thinning, or receding hairlines, especially if it starts early, often take a blow to their self esteem. But sometimes the reasons can be out of our control. Some of these are genetics, hormonal changes, and environmental pollution, though diet and lifestyle choices can also play a part. For many, the only way out is often a hair transplant. A thick mane can not only lift your appearance but also your confidence. So, here are some details about what hair transplant is, how it's done, and how much it can cost. However, do discuss it with your doctor to understand clearly what to expect before, during, and after the procedure. To put it simply, hair transplant means removing strands of hair from one part of your scalp and implanting these in the parts with thinning or no hair. The procedure started in the US around the 1950s, though techniques have been vastly improved nowadays. This is how it's done. First, the surgeon will numb your scalp. Then, for the transplant, either one of these two methods is used: follicular unit strip surgery or follicular unit extraction. In follicular unit strip surgery, a 6 to 10-inch strip of skin is removed from the back of your head, which is then sewn up and allowed to heal. The strip is then divided into 500 to 2000 tiny grafts, each containing one or a few strands of hair depending on your hair type, quality, color, and transplant area size. For the follicular unit extraction procedure, the team shaves the back of your scalp and removes hair follicles individually. The area heals with small dots that your existing hair will cover. After preparing the grafts, the surgeon cleans and numbs the transplant area, creates holes or slits, and places each graft into them. Team members often assist with this. The procedure takes about 4 to 8 hours, and additional procedures may be needed if hair loss continues or if you want thicker hair. After surgery, your scalp may be very tender, requiring pain medication for several days. You will wear bandages for at least a day or two and may be prescribed antibiotics or anti-inflammatory drugs. Most people can return to work within 2 to 5 days. The transplanted hair will fall out within 2 to 3 weeks, with new growth appearing in a few months. Most people see 60% new hair growth after 6 to 9 months. Some surgeons recommend minoxidil to enhance growth, though its effectiveness is uncertain. So, do hair transplants work? Globally, around 60% of men and 50% of women experience some degree of hair loss. Hair transplant is not effective for everyone. It is primarily used to restore hair for those experiencing natural balding or thinning, or for those who have lost hair due to injury.
Hair transplant is advisable for any age group above 20 years. Either they are male or female, depends on their medical issues, underlying diseases, and also side effects, and if they are allergic to such procedure, or the solution that we use in the hair transplant is very much important than the procedure that we do. So, if the person is actually healthy and the blood reports what we suggest is favorable for the doctor, we can anytime directly go for the hair transplant.
What about the cost? The cost of hair transplant largely depends on the amount of hair being shifted, typically ranging from 30,000 rupees to 1 lakh rupees. Most insurance plans do not cover this procedure.
Hair transplant is advisable for any age group above 20 years. Either they are male or female, depends on their medical issues, underlying diseases, and also side effects, and if they are allergic to such procedure, or the solution that we use in the hair transplant is very much important than the procedure that we do. So, if the person is actually healthy and the blood reports what we suggest is favorable for the doctor, we can anytime directly go for the hair transplant.
Coming to the side effects, like any surgery, hair transplants also carry some risks such as bleeding and infection.
If everything is favorable, there is no actual side effects for that, but yeah, definitely there are minor side effects like swelling, heaviness, and sometimes the procedure is not good enough. There will be a failure rate of the hair transplant which is up to 50 to 80% also, which is actually considered as failure hair transplant.
There is also possibility of scarring and unnatural looking hair growth. Additional possible side effects include scalp pain, itching and swelling, inflammation of hair follicles, sensation loss around the surgical sites, patches of hair that do not match the surrounding hair or appear noticeably thinner, persisting hair loss if balding continues. The success of a hair transplant relies on various factors such as the surgeon's expertise and the quantity of hair transplanted. Although Indian success rate data is unavailable, a 2020-22 global survey of surgeons revealed that 68% typically achieve successful results with just one procedure. However, multiple procedures may be necessary to achieve the desired look.
A full head of hair gives confidence and makes us feel good. But do consult a doctor before deciding on a hair transplant. And remember, being bald is perfectly okay too. Just own the look.